So when the patient comes to the sleep clinic, they are referred by the primary care physician, and they are informed that they have a high suspicion of sleep apnea and that they will get investigated and treated with CPAP therapy and everything would get better. The important thing to understand is that CPAP therapy does not improve outcomes, all the outcomes which are related to obstructive sleep apnea. So obstructive sleep apnea can give a lot of different symptoms because it affects the following. So it affects the sleep architecture. It can cause excessive daytime sleepiness because the sleep architecture is lost and there is sleep fragmentation. It can affect neurocognitive function, mood, quality of life, and it also increases cardiovascular disease risk. So CPAP therapy can resolve all the obstructive and partially obstructive respiratory events, partially obstructive by which I mean hypopneas. It can improve sleep by increasing stage 3 sleep or N3 sleep, which is also called deep sleep, and also it improves the REM sleep, which is the rapid eye movement sleep. The effect on stage 1 and stage 2 sleep, which are called light sleep, and the total sleep time seems to be inconsistent. Various studies give varying results. The effect on daytime sleepiness. If the patient has got a severe obstructive sleep apnea based on an AHI of greater than 30, then they feel there is a subjective improvement in their excessive daytime sleepiness. The optimal duration for CPAP therapy to improve the symptom is not known. Probably there is a big variability from person to person. Some people who use less than 2 hours per night of CPAP have a full improvement in excessive daytime sleepiness. Others who use it more than 6 or 7 hours per night have no benefit whatsoever. So there seems to be a major variability. We also find that there is an improvement in the sleep latency by nearly a minute in the MSLT and MWT tests, but they are not statistically significant. And if this increase in sleep latency, increase in the sleep onset latency, if it has a clinical significance, again we do not know. As I mentioned already, some people, despite using the CPAP and you confirming that they are compliant with the CPAP therapy, still have significant excessive daytime sleepiness. The prevalence at this stage is unknown, but it is suspected it would be about 20 to 30% of patients who are compliant with the CPAP. The 20 to 30% is people who have some amount of sleepiness, but people who have very disabling daytime sleepiness will be much smaller than that, probably less than 10%. The pathophysiology for this is unclear. It is thought that there is neuronal damage to the certain areas in the brain which promote sleep-wake cycle during the intermittent hypoxemia which happens during severe obstructive sleep apnea.